Hello, welcome everybody that's filtering in. Welcome. My name is Tali Schiller. You are joining a webinar called Surviving the Early Career Transition, How to Get Hired in Local Health. We are going to hold for a minute and wait for people to trickle in, but we'll be getting started soon. Hello, everybody who just joined. We will be getting started soon. We're just waiting for a couple more people to trickle in. I'm going to give it a couple more minutes. Hello and welcome to everybody who just joined. We are going to give it maybe one more minute for people to continue to trickle into the webinar, and then we will get started. All right, folks, let's get started. Welcome, everybody. Welcome to today's webinar, which is entitled Surviving the Early Career Transition, How to Get Hired in Local Health. My name is Tali. I am the Program Director of the Academic Public Health Corps, and we are very happy to welcome you to today's webinar. We have 5 wonderful guests today, 4 panelists and 1 moderator, who are all working in local public health and very excited to share their stories with you. So before we start, I'm going to share a little bit with you about the flow of today's webinar. For the first half hour or so, our panelists are going to answer a few pre-written questions and kind of describe their local public health journeys so far. In the back half, we're going to pivot to audience questions. So please write your questions in the Q&A box at any time, and we will get to them in the back half of the webinar. I will be sharing a few links with you in the chat, which includes full bios for all of the panelists, so you can learn a little bit more about them, as well as a link to a job board for jobs in local public health. This webinar is being recorded, so we will email the recording and all the materials early next week. And that's all of the business up top. With that, I'd love to introduce our moderator for today's session, Ian Wong. Ian is the Deputy Director of the Division of Public Health for the City of Worcester, Massachusetts, as well as being adjunct faculty at Worcester State University, where he teaches Introduction to Public Health. His roles have ranged from directing health promotion efforts at Tufts University to leading statewide opioid prevention initiatives at the Massachusetts Department of Public Health and guiding local boards through public health crises. Take it away, Ian.
Okay, thanks, Tali. Yeah, I want to welcome everyone. Thank the panelists for being here and, being part of your, for those in the audience, this great journey in public health. I've been in the field for 40 years, somewhere around 4 years plus. And just to let you know, I can still remember what it's like to begin with and how to start. And tell you, I have to tell you, I'm heading more toward the end of my career to the end and tell you, it's been a fantastic journey. You're going to meet some of the greatest people, see some of the greatest things you ever see. And, here's a great introduction to meet some of those people out there who you're going to be one day. So let me ask a question to panelists and they'll be able to give a brief of who they are. So I'm going to ask all the panelists if they can briefly describe their jobs and what a typical work week is like. So Brianna, can you start for us?
Yes, so hello everyone. My name is Brianna Richardson. I use she, her pronouns, and I work at the Boston Public Health Commission in Boston, Massachusetts. And so I started as an intern and of last year. And so I work with the Infectious Disease Bureau within the Education and Community Engagement Division. So doing lots of education and outreach related to infectious diseases, talking about COVID, talking about the flu, RSV, lots of things, and getting to beyond making materials and doing things for social media and working on health communication. We also go into the community to be able to do trainings with individuals and with organizations and to be able to table and to really just get information out to the Boston neighborhoods around infectious disease and how they can learn more about it related to their positions, related to where they live, lots of things like that. And so I continue to work part-time as I'm finishing up my MPH at Boston University School of Public Health, but I look forward to transitioning into a full-time role after graduation. But a typical work week is really just kind of looking at a lot of whatever the rates of COVID, of RSV are, and how are we addressing it in a presentation that we're making for high schoolers, or a conversation that we're going to have with another department within our very large organization, which BPHC is. But it's a good variety of working in the office, also being able to go out and do trainings for ourselves and for others. So yeah, I'll pass it on to the next.
Yeah, thanks, Brianna. Connor?
Yeah, hi, I'm Connor McCombs. I'm the Health Communications Officer for the City of Somerville Health and Human Services Department. A typical work week for me is very variable because communications, much like public health, is extremely broad and kind of just meet the demands of what's put in front of you that week, whether it be promoting an event, running an event, or you get pulled into hiring new Board of Health members. I have done all of those things in my first year since finishing my MPH at BUSPH. So something I've very much enjoyed about working specifically in local public health and in communications has been that I get to touch so many different areas of public health. I work regularly with our mental health services team, our prevention services team, our public health nurses, and so many more areas of the department, all while keeping those core tenets of equity and communications and accessibility at the forefront of our mind, and making sure we try and keep those things as let those lead us as much as possible when we make our communication strategies.
Okay. Thanks, Connor. Sophie?
Hi, everyone. My name's Sophie, and I'm the Mystic Valley Public Health Coalition Prevention Coordinator. My physical office is in Medford, but I work with 7 communities on a youth substance use prevention grant that focuses on primary prevention. So I'm working with Medford, Malden, Melrose, Reading, Stoneham, Wakefield, and Winchester. A lot of what we are doing is working with our young people, families, and youth serving organizations. That means a lot of my work week is focusing on our partnerships with our schools, health departments, families, students, and police. I would say a lot of my week is spent on meeting facilitation. Over the past year, I did a lot of work on our strategic plan because we're funded by the Bureau of Substance and Addiction Services. I work on capacity building activities, which means basically creating trainings or finding trainings for the folks who need to build up certain skills to do the work that we're trying to do. A lot of work for our actual grant, so reporting, invoicing, budgeting, things like that. And then I also work with a youth coordinator and a health communication coordinator. They're both part-time and doing a lot to make sure that our day-to-day is moving forward. We also have a public health youth leadership group, which is a regional youth group, and they are focused on supporting a lot of the work that is written into our strategic plan, as well as driving their own initiatives to improve health in their local communities.
All right. Thanks, Sophie. Okay. Nicole?
Hi, so my name is Nicole Marvez, and I am a public health specialist. Similar to Sophie, I'm also on a regional team where I'm physically based in Brookline and Newton, but I serve 4 municipalities overall. So one half of my job is a typical health inspector job where I'm inspecting restaurants, housing, nuisance complaints, doing community programs, that sort of thing. And the other half is my regional task, which is managing grants. We're currently dealing with an FDA grant to standardize our municipalities so that we're as close to each other as possible. And also just trying to standardize in general all of our things, share inspectors, share our special tasks, and creating programs that benefit all 40 municipalities at once and pooling our resources as much as possible.
Great, thanks. You know, so we've all gone on this journey from school to now your jobs out there. And like I always like to think about taking that science to practice kind of thinking. So can you tell us about that journey from school to your work? And can you also talk about, because I think, you know, a lot of students now have to do internships and how that will play the role in you getting a job. And the other piece too is, you know, how faculty and staff can help you in supporting you get those jobs. So all those pieces of, you know, I take it was much more than just classroom work that help you get your job, but those internship faculty helping, those mentorships, and you know, all those resources that probably now you look back and said, wow, there's a whole group of people that support you, support you in this journey here. So Connor, can you start for us?
Sure. Yeah, I mean this with as much love and respect to all the professors who I've worked with and who have taught me so much, but I would say the classroom part of my MPH was actually the least impactful in terms of what got me my job and helped me figure out what I wanted to do. Your internships that you do during school are hugely helpful. I did a couple. I worked closely with Teresa, who is here now, works at MHOA at Public Health Post as a writer and a podcast host and a lot of communication stuff there. I learned that I loved communications and thus I'm now working in it. I also worked with APHC during my time doing my MPH, and that kind of taught me the basics and how different all the municipalities in Massachusetts can be. And I wasn't sure if I would love local health, but I thought it was a good way to try it out. I really think you can get a lot out of your internships and let the experiences you get there guide what you are, learn what you are interested in and even what you're not interested in. There were some things I did with APHC where I was like, that was a cool experience. I never want to do it again. And here we go. That's, I think actually the most valuable thing was learning what I did not want to do.
Thanks, Connor. So other than me teaching intro to public health at Worcester State, we'll make believe that some of that academic work helped you get there. Yeah, I appreciate it. Okay, Sophie.
So I just starting a step back from my MPH, I originally thought in undergrad I was going to pursue the clinical psych field. And that's what I had my heart set on. That's what I studied in undergrad. I went on to work in clinical research and then ended up doing on the side work with another research lab that was really focused on serving the community with this public health lens. And that's when I started realizing that, oh, a lot of my questions that I inherently ask are really aligned with the field of public health more so than perhaps clinical psych. So that's what I pursued in my master's. And while I was there, I would agree with what Ian said. There's so many resources that maybe I didn't fully appreciate at the time. So definitely lean into those as much as you can. I found personally that both in undergrad and in grad school, faculty were really, really open to working with you, working through questions that you might have, pointing you in the right direction. When I was in school, it was both an internship that then turned into a full-time job, but I was working on a research study that was focused on the genetics of psychosis in East Africa, which was very different than what I was doing before. And I loved my time doing that. It was amazing. I learned so much. There are so many opportunities in doing that and just thinking about global health. Um, but what I realized is that I really did want to try something, one, that was outside of research, and two, something that felt a lot closer to home that was impacting the environment around me. So that's when I started going back to professors and saying, hey, how do I make this work? What does that look like? And then also then interned with the APHC, and that's what pointed me towards local public health.
Okay, thanks, Sophie. Nicole?
Yeah, so when I was in undergrad, I originally started out in engineering and I realized I really did not like it. And no matter what, I truly did like public health. That's what I wanted to do. So I switched to be a health science major at BU. And my classes actually influenced what I wanted to do a lot. I found that I loved my policy and regulation classes. I know a lot of people hate that stuff, but I love it. It was so interesting. And I was like, that's what I want to do. I want to write these policies. I want to put them into practice. That's what I want to do. And so then I joined the APHC my second semester senior year, and we went and we visited a health department. And at the time, I didn't know anything about local public health. I was focused on federal. That was all I wanted. But when I went into local, I realized that they actually have a lot of influence in policy. They do so much, and they're right there in the communities on the ground talking to people and actually they're the ones actually putting these policies into practice. And that's when I realized that this is what I want to do. I want to work as an inspector like these people and serve the community right on the ground. And so I just started to apply to all the inspector positions I found in the greater Boston area. I really leveraged what I had learned in my APHC experience, and I hadn't done much with public health outside of my classes in school, but I did have multiple positions with clubs and with other jobs, and I leveraged those skills as they related to public health. And that's what brought me to be a part-time public health specialist for Brookline. And just 2 months ago, I think, I was upgraded to full-time.
So congratulations. Brianna?
Yes. Like I said earlier, I started this position because I was actually doing it for a practicum. But going back a little bit, was as I was in my MPH and learned about the APHC, I knew that I wanted to learn more about local public health in Massachusetts. I had previously done work out of the state, but learning about the unique system that exists here, I really wanted to have kind of a full semester to learn about all of the different or a lot of the different local health departments that exist. And after that experience and being able to do a lot of the work that we're able to do in the APHC, I really knew that I wanted to be able to stay here and learn more at a specific health department. So thankfully, I was able to get a practicum at BPHC and be able to forge some great relationships here. And continue on after that experience ended. But I really valued the opportunity as a grad student to be able to have kind of to cherry pick lots of the different experiences that exist in our state, and to be able to visit those health departments and to be able to work on lots of different projects on lots of different topics, to really learn about what public health looks like here, and how there are lots of different ways that you can engage in it. And that really moved me forward into knowing that I wanted to work in the local public health field in the long term.
Okay, thanks. So you've now all been in the workforce, right? Been out there and working, so forth. So if you can imagine yourself not being in one of the four squares here, being a panelist, but you were on the other side, out there listening. And so I always think about this thing that I always would tell, like, I wish I knew, I wish I knew, like when I was a first year going into college and seeing the orientation, that yes, I'd make friends. I wish, you worry about those things. So if you can, just kind of think back, what are the things you've learned about thinking of how to apply for a job when you got your job, some of the interview nuances you saw, that now, if you could think about who you were, just first applying for jobs and getting into the workforce and all that, and saying, I wish I knew now what I knew then, to make that transition in there. So Sophie, can you start with it? Can you start?
Definitely. I think about the job search just more broadly and maybe not even specifically about public health, but if you're able to, and I realize the job market is challenging right now, but really focus on the roles that you're genuinely excited about and you really want to pursue that because that's going to come through in the way that you write your cover letter and communicate with folks and interview. And I just think you're going to end up saving yourself time by focusing on some of those positions. I also would say in the area of just networking and looking for positions, or maybe you're in the point where you're like, okay, I'm finishing my public health degree, but I still don't really know what I want to do. I would say go look for people who are doing roles that you're like, that's really cool. I want to do something like that, even if that might be, further down the line in 10 years, something like that, and try to learn about how they got there, why they're doing the work that they're doing now, and what they like about their role. And then target those questions specifically. So if they're a recent grad, you can ask some of the questions that we're talking about here tonight. If you have the opportunity to talk to someone who's a little bit more senior, really spending time hearing about the journey, I think is important because that also could give you a little bit of insight in what you need to do in order to get to that point.
Great, thank you. Nicole?
I wish I knew when I first started the job application process that at least with local public health, it's a lot more personable than I originally thought. I was always told a lot about, oh, they're reading your resume with algorithms, so you have to hit all these points. And so originally that's what I was doing is I had 10 different resumes with all these different like keywords and like I had all these different cover letters. And I was just throwing them out there at all these local departments, and I was hearing nothing back. And I was like, I don't understand what's going on. And eventually I talked to some older BU students who had worked with government with internships. And I discovered that no, with local department, that it's actually the inspectors reading over your resume. And so if it's just like a template that you like very like trying to follow that algorithm, they're not really going to vibe with it. The same if you had actually just let your personality shine through. And so I completely changed my resume. I put like a personal bio at the top talking about myself. And immediately I heard back from Brookline. Like that was the first one I used that resume for. And that was when I realized that no, leveraging having my personality show, my charisma, who I am as a person, that's going to help you so much more in local public health than just here is every accomplishment I've ever made and how it perfectly fits this job description. They're looking for someone who's going to be able to interact with the community very well, and that is what's going to show that.
Yeah, that's perfect. Brianna?
Yeah, I think I would just tell my past self more about networking and just being able to put yourself out there and have experiences, even if they're casual experiences, to meet folks, because you can really learn more about the idiosyncrasies of lots of different health departments and what it's like working in that area, working in that topic area, especially too, and being able to just learn what your fit will be, because I think a lot of being able to look into finding what you really want to do is not really knowing what the actuality day to day is, and so learning beyond if you're really interested in working in sexual health or really interested in working in environmental whatever it is, knowing what that day to day looks like and having a face to all of that kind of puts it into perspective beyond being able to, if you have a internship opportunity or being able to really work in that before you're doing applications, and also just getting to know folks. And so, whenever they see your name on a resume, on a cover letter, you already got one foot in the door.
Great. Connor?
I don't know how I'm going to say anything that all of these other panelists haven't already kind of touched on, but yeah, there really are, especially in local health, people reading your resume. I've been one of them many times. Making yourself personal and likable really helps because I guarantee the person has read 20 resumes before yours. Um, but other than that, really knowing the position and the services that you're kind of applying to. I was very into Somerville local politics before I applied to the job, and I was very I don't know if it was luck or what, but when I got my interview, I happened to be interviewed by the prevention services manager, and I had done multiple articles and papers during my time doing my MPH about the safe consumption site Somerville was trying to open and how we were preventing overdose deaths. So knowing those systems, knowing the efforts that the city is doing, especially if you're applying to a local job where you can see like what that city has done, who's been working on it usually, knowing those things is very helpful when you get in the interview. A lot of the times getting the interview is somewhat a luck game, somewhat a numbers game, just doing the best you can and not getting discouraged. With local health, it can take a while to hear back because everyone is doing the jobs of everyone's doing everything all at once. So when you're hiring someone, that kind of just gets put on top of your normal workload. So it can take a while for people to get to it, but be patient. Don't get discouraged if you don't hear back. Just keep going.
Yeah, thanks, Connor. Yeah, and it's one of those people who read the resumes and looking for staff. As a matter of fact, I'm in that process right now. You're right. The process takes a while, so don't get discouraged. It kind of goes. But like everyone's saying too, also do your homework and learn about the local public health because we're all slightly different. And you can hear each of our philosophy. And like everyone says, in my kind of thinking, we can teach you how to do epidemiology, right? Epi's, epi, right? The real thing though, do you fit with my team? Do you fit with our philosophy? Do you think, where it's going? And Brookline has a great department in what they do and their size. I mean, I'm in the second largest city, so we have another kind of set of philosophy, especially when we have a lot of lower income, homeless populations out there. And so that's one thing too. Do your homework, think about where you're applying to, what their beliefs are. And the other thing too is I'm actually looking a lot of times for problem solvers. Who said, yes, I can do this, but let me tell you how I kind of did this. Let me tell you how I figured it out. And I kind of think that's the people I'm looking for because you read a lot of them say, oh, I took this class, this class. Well, everyone took those classes, and I got this, but really those who say, yeah, I took this class because I have a love for, this community. I really enjoy doing this. And that piques my interest. And like you're right, Nicole, that's something that the algorithms can't pick up. It's just that love and joy that I hear in students' voices, who want to do it. So that's great. So let me look at Tally, because we, getting to that time and trying to get some of those online questions. Oh, we can't.
I'm muted. I have our first audience question right here. For anyone that would like to answer, what is the best way to navigate this current market? It's been tough getting a response from job applications.
I think, it's a big question. I will say from my experience in the jobs that I've had since undergrad, and the ones that I've gotten are always ones where I've started by contacting someone directly in the organization itself rather than simply going through the HR portal or, whatever they have set up. So if you know the team that you're applying for, reaching out to the hiring manager, something brief, don't, overload them with all the information, but you can attach your resume and your cover letter. So I think that is a way to stand out. I don't know that that is like the key to everything, but it could at least boost you to the top so they recognize your name when they do review everything later.
Yeah, I would agree. Recognition in some capacity is huge. I know for me, almost everyone who works at the Brookline department went to BU, and I also went to BU. And that definitely helped me a lot because 95% of people there also went to BU. And you can just look those things up on LinkedIn and you can find if there's someone in the department, did they study the same degree as you? Did they go to the same school as you? Are they from the same state as you? Obviously, have your LinkedIn on private mode when you do that. But knowing the people you're dealing with at the department you're applying to, if you're going into government, will definitely help you because it is such a recognition thing.
I think also for those of you getting MPHs, a lot of your professors or the people who work at your public health school have probably worked in local health, especially here in Massachusetts, where every city has its own health department. I know having those connections was very helpful. Teresa, who I worked with, has worked in local health before, and she was able to give me a lot of tips and point me in a lot of different directions when I was an APHC intern and after when I was applying to jobs.
Yeah. If I could pipe in for a second too, yeah, exactly what it says. Two, don't get disappointed if you don't hear back quickly. It's so easy to get disappointed really fast. And like you're saying, everybody knows everybody in the field. Everybody knows each other. And a lot of times it's by happenstance too, because I encourage students, they'll call me and say, hey, can I just talk about the field and all that? And sometimes by chance someone says, I'm interested in this. I go, you know something? I was just talking to Sarah over in Northampton, and they're looking for somebody over there. Why don't you give her a call and see what's up and over there? Because everybody's connected, everyone's searching, and sometimes and like you said, sometimes it's just a numbers game. I look at all the resumes I have; they're really good, but you got to choose one. But if you kind of get yourself out there and kind of put like Nicole said, it isn't by happenstance that everyone's from BU and everyone knows each other from there. So, okay, what else do we have, Tally?
All right, up next is, what are some effective strategies for networking and building connections in each of your positions? So I would love to hear specific strategies for networking. What do you do?
Go to every alumni event that you can, especially if they are free. One, they normally have free food and free drinks at alumni events, and you're all probably poor grad students, so that's always nice. But a lot of alumni are there. A lot of your professors are there. It's a good way to meet people. Um, and it's a nice casual environment. A lot of them are truly just there to have a good time and hear what's been happening at the school or hear whatever speaker your school has brought in. And they'll be looking to hear from you, honestly. A lot of them want to talk to you about their work. And if you are receptive, they will be so excited. They will remember your name. They will add you on LinkedIn. Alumni events are great.
While you're in school, being able to, talk to any of those professors that really like, a project that they've worked on, an organization that they've worked with, being able to ask them more about that, and to be able to build your network, of someone who's done something like that, if they know about any positions or any ways to be able to get into that field, is really helpful. I think also like using LinkedIn, as we've talked about. If there's someone that, they went to the same school as you see that they're, in the same alumni group, or that you really think that they have an interesting position, reaching out to them, and, kind of sending a message, asking to connect with them, and ask more about, how they got there, if they have any tips, and building out your network even virtually, is also really helpful.
I would also just say in terms of mindset, because I love the idea of alumni events, LinkedIn is a big one. Also talking to folks in your cohort and see if there's anyone who knows of any organizations or faculty. But overall mindset, I would go into a lot of those conversations with the thought that people do actually want to help you, because I think people do. In my experience, we all have been in your shoes and we all know what it's like and the anxiety of trying to apply to a job. And folks are usually happy to chat with you. The worst thing that can happen is that you get ghosted or they say they don't have time. So that's really a pretty low risk ask.
Okay, Thank you. I will move on to the next audience question, which is, it's hard to know what you really want or can do without the first hands-on experience. Could the panelists kindly share their very first internship or volunteer experience about public health and how it played a role in their later careers?
Go. So in undergrad, I was able to intern at a local health department back in North Carolina, so out of this system. But it's at a county level, and was able to work on another outreach and education type team to be able to learn more about how I really wanted to engage in public health, what it looked like. And I was able to, work in the schools actually, and be able to work with middle schoolers and high schoolers talking about sexual and reproductive health, healthy relationships, and to also just learn about how the county commissioners worked, how things actually in the process of getting things clinically checked so we can have presentations to certain populations, and just learning about all of that. It was really interesting just learning about systems on the local level, how slowly government works, even though it's wonderful. We there are lots of things that take time, and learning about that pace.
Does anyone else have a first experience that they want to share?
I briefly mentioned this, but what I ended up doing was taking on a volunteer role with another research lab that just really piqued my interest. And that was that was my first job out of undergrad. And that was at the Community Access Recruitment Engagement Center at MGH. And it was a fantastic experience just to understand what does it look like to enter into the field of public health in the first place. What does it look like to do community engaged research? Who are the local players? How do you set up some of those events and education series? And that really has shaped the rest of my career from there. That was a major pivot point.
And I ask a question off of that. So now that you're working out there in the field and you know what the health departments look like, can you kind of describe in any form you want the diversity of people there, what they do? Because I think sometimes you kind of think, oh, I want to do this, but when you get into those office spaces, there's a whole world that the job description didn't describe, or there's a job there that I didn't even know that was a job because I didn't take that class or see that. So can you kind of tell that, now that you're there, you're seeing this bloom of, different personalities, different people working on different things. Can you kind of describe that? So, Connor, you want to go? There you go.
I think our shared services people can probably speak to the diversity of types of health departments you'll encounter in Massachusetts. Massachusetts being a commonwealth, like I said, every city has their own health department, and that can be one person, it can be 100 people. It's very varied, and depending on your role, which can also be extremely varied, you're gonna be doing very different things. My role being in communications, I actually act primarily interdepartmentally. I interact more with the mayor's office and our translation services over in the immigrant affairs office and our communications department, our main communications department that like runs the main city communications for all other departments, more than I probably interact with my public health colleagues. And I'm sure some of them feel incredibly insulated from the rest of the city. It really can depend based off of what you end up doing.
So,
Yeah,
if-
so I agree. There is a lot of diversity in the health departments, and that's definitely something you want to look into if you are applying for health departments. For example, when I was with the APHC, I visited Medford, and they have they have mostly renters, people who own their own home, and so it was a lot of just restaurant inspections, that sort of thing. And then I came to Brookline, and it was like night and day because Brookline is a very wealthy community, and people, we say they're professional tenants, professional landlords. And so housing cases there are very, very different. You have to know the housing code like the back of your hand versus in Medford where they have some sort of housing issue and they can usually sort it out. They told me they hadn't written a ticket in 7 years. In Brookline, we write tickets every week. So it's very different between health departments. Um, but one thing I was very pleasantly surprised by is, at least at Brookline, it's like a very welcoming, friendly environment. I'm someone who kind of struggles with professionalism a little bit. Like, that's just not my personality. I'm just naturally a pretty friendly, talkative person, as you can tell. And so I was really happy to show up to the office and everyone's just talking casually, and you can say, "Oh, this case is driving me crazy." You don't have to you sugarcoat it. You can just talk honestly. And I feel like that really helps all of us do our jobs. Sometimes it can be really frustrating, and just knowing you can say that I'm really frustrated. Someone else, please look at this case for me. That just makes it so much better and is why I enjoy what I do so much.
Thanks. Let me get this. So, Tally, there was something about certifications.
Yes, let me read out the next audience question. Are there any specific certifications or additional training that can enhance opportunity in your positions?
Yes, but you should not pay for them until you have the job. And anyone who works for the departments will likely tell you the same thing. There's a lot of there are dozens of licenses and certifications if you're an inspector, for example, that you have to get. And honestly, don't pay for them yourself. They will pay for you to get them. I would say it's kind of an expectation on their part that they know that having you showing up with those, not having worked at the health department before, would be very unusual. Um, the best I would say is just emphasize in a cover letter or a resume that I am more than willing to get these certifications. Like maybe you could start studying for them, but definitely do not pay for any of these until you have the guaranteed position, and the department will most likely pay for them for you.
Yeah, I would say unless you're coming in to be like a mental health services person where maybe you have to be a licensed mental health counselor, don't do it because you might come into the role thinking you need certifications and then not. I have never touched a health inspection certification because it's just nowhere near my job description. Our inspectional services are basically their own department separate from the other health services. So a lot of what they do, we work very closely, but those those inspectional people have all of the certificates, and then most of the people I work with do not.
Thanks, everybody. I'll move it along to the next question. We have had this question a couple of times, and I think that this is on a lot of people's mind as more and more people with a bachelor's degree in public health enter the workforce. And we're a little skewed towards MPHs in this group, so this might be a question for Nicole. Does a public health bachelor's get you a good paying job, or would a master's be more beneficial? What are your thoughts?
So it can, hence, I have a good paying job with just my bachelor's. But I will be completely honest, it is difficult out there, especially in Massachusetts. A lot of people have masters in public health, and they're just inherently going to be more attractive candidates than you are for the most part. And it was pretty discouraging for me. I kind of felt like this is impossible. I'm never going to get hired if I don't have an MPH. Like, this is ridiculous. I'm still the only one at Brookline that doesn't have an MPH. And so like you are an oddball, but it's not impossible. You just have to leverage everything else that you have. So I mentioned before, like I talked about my classes, my clubs, my other jobs, like just show everything else that you have that proves, hey, I'm not 25 with a master's degree, but I still can do this job just as well as they can. And that's pretty much the best you can hope for. Like, it is difficult with just a bachelor's, but it's not impossible. I just have a bachelor's and I got this position. So, don't give up if you can't get any position with just a bachelor's. You do not have to pay for a master's if you really don't want to.
And let me add an experience too, because we were looking for jobs. I was talking to my HR, and at Worcester, we're really trying to get away from the degree emphasis. It's a nice add-on and all that, but really, can you do the job? Because it was funny, because one of the jobs we're looking for, it says you have to have a bachelor's in public health, and we'd like to have a master's and all that. And I looked at it and I said, if I apply for this job, this is the opposite. I don't have a bachelor's in public health. So it's ironic. I can be the deputy director of it, but I can't get an entry-level position because I don't have a bachelor's. And we're kind of saying, we got to get away from the degrees. Just get, what's the experience that, what's your knowledge set and all that. And there was a great article that came out a couple of years ago that really said if we were to really boost the public health infrastructure US, we have to get more bachelors into the field and into the working place and all that. It was a great article, which I can give to Telly and they can get out there. So don't be discouraged and kind of put it out there. And it's really, pushing that way too. But you're right. A lot of times, unfortunately, sometimes, we all have our masters and doctorates and all that, that you kind of put that way. But, the work's the work and it's really the quality. So don't get discouraged. Okay, Telly.
So I have a question that's just for Connor. As a health communication specialist, any advice for people who want to get into the field and improve their skills?
Oh, yeah, there are so many opportunities to improve your skills in communications. Honestly, the biggest one just being to pay attention to them. Read some press releases, especially if you're applying to a communications job for a local position. Read press releases from that city or from that health department, see how they format them. If you can talk about that skill and having written a press release before when you come into the interview, or be familiar with how that city does their primary communications. Do they do community notes? Do they do newsletters? Being familiar with the format that they use most often is very helpful. Learn Canva. Everywhere uses Canva now. It's super easy and people will be very impressed with you when you use it. It's doing social media sucks and you don't want to be a social media manager necessarily, but a lot of people will look. Social media is how a lot of health information goes out now. So knowing how to do that is extremely helpful. Yeah, I think reading and really practicing those skills of learning how someone communicates and trying to see if you can emulate it and then clean it up yourself and learn to do that is a really good way. That was what I did a lot when I first got this position. Was I looked at previous press releases that our communications department did, and I would try and create the press release I was talking about in that style. And then I would go to the director and be like, this is what I came up with. What edits would you have? If you can learn that process ahead of time, you'll come in with a leg up.
Thank you. Next, we have another question for everybody. I'm graduating with a bachelor's degree in public health. I plan on taking a break before heading towards my MPH. So what suggestions would you have for someone like me who is currently trying to find a full-time job and gain some in-field experience? So advice for someone who is graduating with their bachelor's degree.
I think from what I saw in at least the MPH program that I was in, it seemed like people came from a whole range of backgrounds in terms of their job experience. I remember some folks were in nursing, some people were in their third year of medical school, some people came from research. Some people came from engineering, like it was all over the place. So I really think pursuing something that you think aligns with public health in at least some way. I mean, it obviously has to align in some way, that your bachelor's degree applies to right now. And then using that time to build up skills that you would need in order to apply for an MPH down the line. But I don't think that you necessarily need to have one track in order to then pursue an MPH later.
I think this will mud up the waters for this person clarity-wise even more, honestly, but I came into my MPH after 3 or 4 years leaving my undergrad, and I had only worked, I did not have an undergrad in public health or any kind of related field. It was in English, and I worked in real estate and mortgage for 2 years before I went to get my MPH. And it's really just about when I got into my MPH, it was really just about my interest in being able to sell the skills that I had picked up in working in mortgage. So you could really go anywhere, which I know is not helpful, but you can really do anything and still be able to market yourself towards public health because public health touches on so much.
So I think this next question is very related. After getting a bachelor's degree, is it best to take a gap year or go straight to a master's?
Work.
I'm sorry. Yeah. I also think it's like whatever, you are able to do, whatever your comfort level is. If you I know coming out of a bachelor's degree, you can, already be in the move of, staying in with classes. You're already ready to study, ready to do whatever work it is. So if that's what you're comfortable with and going straight to the master's works for you and, the finances and everything work out, I say go and do it because that's still life experience. You're able to, still have internships and be able to work in the community that you're going to school in and whatever it is. But if a gap year makes sense, that is, being able to have work experience and have time away so you can bring those additional experiences to your master's degree to contextualize whatever you're getting that degree in. That's also beneficial too. But it's very personal, I would say, of whatever works for you in this situation.
And if I can add one piece that looking at this is something so good. A lot of times, again, if you're going to academics, research, sometimes you go that bachelor's, master's, PhD, and you're in that world. But just remember too, and like everyone here, you're coming into the workforce, right? And what I'm looking for, someone coming into the workforce who's ready to do work at a professional level and all that. So sometimes those who take that little time off, get into the workforce, kind of knows, right, expectations of the workplace, getting along with others, doing some of that and moving in. So you can kind of do both, but don't feel like, oh, I took 2-3 years off and, when I come back in. A lot of times, sometimes they've learned this how to navigate, right? Because you all have a job and you just have to navigate in the workplace, and sometimes, some students I see need that kind of experience being out there in the workplace before they come into the field.
I would also highly recommend working, but I'm biased because that's what I did. I worked for 2 years. I believe in order to be in the program that I was in, you needed at least 1 year, if not 2 years of work experience to apply. So that was really helpful because then people in our classes were able to bring all of these different, work experiences to the table for all of our discussions. And for me, that was really rewarding.
Thanks, everybody. If I can add my voice to this chorus, I am also a huge proponent of working and before going back to school, because I think that there's nothing that can replace that work experience on your resume and in your background. That's what employers are looking for. Like, a degree is great, but I think everybody on this panel said, or maybe it was just Connor, the stuff that he didn't learn, that he learned in the classroom, wasn't actually the stuff that he found helpful when looking for a job. So it's really that work experience and meeting people while you're working. That's what's going to eventually, in my opinion, get you that job, get your foot in that door.
So, Tally, let me check in with you with the time here, right? Because it's 5:55. Shall we start up with a summary from the panelists, or squeeze in one more question for someone? What do you think would be?
I think, well, I have one more question in the chat. Unfortunately, we have a lot of great questions that we're not going to be able to get to because of the limited amount of time. So, what if we answer this one final question and then end on final thoughts? So this question is, what is the best way to establish a good reputation as a new employee in local public health?
This was a really big part of my job starting here because I am split across 7 communities. So it's a lot of different health departments that I'm trying to coordinate with. And back to Nicole's point about people being really friendly, I think that in my experience, people are very relationship driven in this space. So I would really take the time to get to know people, even if that means, sometimes your initial meetings are having a coffee, learning what they do, asking questions about, their work, and then getting into it. I'd also say show up and be very present at the things that are happening in your department or across the spaces that you're working in. I make it a top priority to be able to be at local coalition events, local coalition meetings. If people are asking for my assistance with things, I follow through because people will notice that.
Yeah, one thing I think is really important to remember is, like we said earlier, everyone knows everyone. So you want to make sure you're representing yourself well to everyone because everyone is going to hear about it. So, if you're having a bad day or something, still be polite, still be nice, like always just be mindful of, okay, if I tell this person this thing, they're going to tell someone at this department, and then that city is going to hear about it, and then the other city. So not to cause any undue stress, but just be mindful of, okay, I want to really put my best foot forward because everyone's going to hear about me soon. And then once you actually like start working is just taking initiative. They public health, especially inspectional services, they're really overwhelmed sometimes. And so when you say, hey, how about I take that restaurant for you, or I take that housing complaint, they love that. They're like, yes, like we want you to get to start working on this, to start working independently as soon as possible. And so that's really going to reflect well on you that this is someone who learns fast. They're willing to like take the jump and start working independently, and they get along good with everyone.
Yeah, I would agree. Something I really noticed when I started at in local public health is most of the people are in local public health because they really care. Like they want the community to be better. They care about making it better. So when you come in and you're there for the same reason, they're going to be predisposed to like you. What I have found is that most people in public health are also hyper self-dependent, especially in government where things can be very slow the larger they get. They don't want to, they want to do things themselves. They have their process and it works. So if you are coming in and a threat to that process, it's very important to work closely with them in how you do that. Mine was a whole new role, so I had to develop new communications policies for 11 different divisions, all of whom were basically doing communications their own way prior. So it was very important to work closely with my division heads when I developed those policies to make sure I didn't step on too many toes. But ultimately, people will be excited to have you there because as you get into your role, you're taking things off of their plate and making it easier for people to do their job. People are going to be predisposed to like you. So if you work with them, they generally will.
Brianna, you want to kind
Yeah. All of the answers were great. I guess I'll just try to add, just be open, as everyone's really been saying, in all of the different ways that you can be, willing to learn, willing to, just lean on others, see how they do things, how the system works, and just being open to and amenable to whatever that situation is. And really being open to others. I totally agree with you, Sophie, of like having coffee with someone, having, just learning about how long have you been here? What have you been doing since you've been here, at the start of meetings, whenever you start your position. I thankfully that's a culture here in my team. And I was able to do that whenever I started, of just, learning, okay, what do you do? What do you enjoy? What would you like to know on your first day and your first week? And being able to just learn how you can fit into that system, because they hired you for a reason, and you're gonna be able to fit however it is.
Okay, good. Thank you. Let me say just a few words. I turn to Tally to wrap up. So thank you, everyone. And I'll put myself out there. If anyone on the panel, anyone out there want to contact me, you can find me. I'm Ian Wong, the Deputy Director of the Public Health Department in Worcester. Because if someone were to ask me, how did you become the director? Tell me about your path. It's all about the people I met and everyone who helped me and everyone. It wasn't because I did this great thing and that great thing. It was because of the people who I connected with helped me those great things. And so I'm just trying to pay it back to anyone on the call for all those people who I owe my whole career, my whole fantastic life for. So let me turn over to Tally. Thank you, everyone.
Thank you so much to our moderator, Ian. Thank you very much to our panelists. And thank you everybody for coming today and listening to us speak. I appreciate your time and have a great rest of your evening.
Thank you, everyone.